You are alive right now because someone survived the single most dangerous thing a human body can do. Not a war, not a famine. Giving birth to you if you were born more than a couple hundred years ago, there's a real chance the day you were born was also the day your mother died. Not from some rare complication. From the ordinary, unremarkable act of giving birth, the single most dangerous thing an ancient human body could do, repeated by nearly every woman in every generation, with no doctor, no clean instruments, and roughly even odds that something would go catastrophically wrong, and yet the species survived. Billions of births happened before anyone understood germs, before anyone could stop a hemorrhage, before anyone knew why some births took hours and others took days and killed everyone involved. So how did ancient humans survive the one event that every single one of us depends on, when it was also one of the deadliest things a human being could go through? Start with why childbirth was so dangerous in the first place, because the answer is stranger than most people realize. It's not bad luck. It's architecture. Human babies are born with unusually large heads relative to the size of the birth canal, a direct consequence of two evolutionary pressures pulling in opposite directions at once. Bigger brains, which needed more room, and an upright, two-legged walking posture, which narrowed the pelvis to keep the body balanced and efficient on 2 feet. Anthropologists call this tension the obstetrical dilemma, and it's essentially a trade-off our species never fully resolved. The compromise evolution landed on was to deliver human babies at an earlier, less developed stage than almost any other primate, which is part of why human infants are so helpless for so long compared to, say, a newborn horse that can stand within the hour. Even with that compromise, human childbirth remained mechanically tight, slow, and dangerous in a way that most other mammals simply don't experience. Without any understanding of this underlying anatomy, ancient women and their communities still developed a remarkably sophisticated body of practical knowledge, built entirely through observation and passed down almost exclusively between women, generation after generation. Archaeological and anthropological evidence from cultures across every inhabited continent shows strikingly similar practices developing independently. Birth attendants, almost universally, were experienced women rather than men, figures who would eventually be recognized in later, literate societies as midwives, but whose role stretches back long before any written record. These attendants learned to recognize the difference between a slow but normal labor and one that had gone dangerously wrong, watching for specific warning signs. Excessive bleeding, a baby positioned incorrectly, labor stretching on for an abnormal length of time. They couldn't explain these problems in medical terms, but they could recognize the pattern, because they had watched it before, sometimes many times, and remembered exactly what happened next. One of the most widespread pieces of ancient birthing knowledge, found across cultures with no contact with each other, was upright birthing position. Squatting, kneeling, or being supported by others in a standing crouch, rather than lying flat on the back. This wasn't superstition. Modern obstetric research has confirmed that upright positions use gravity to assist the baby's descent and can widen the pelvic outlet slightly compared to lying down. An anatomical advantage ancient birth attendants clearly noticed through repeated observation, even without any concept of pelvic mechanics. Birthing stools, chairs, or simple props to lean and push against appear independently in ancient Egyptian, Mesopotamian, Greek, and Mesoamerican archaeological and artistic records, sometimes depicted in carvings thousands of years old, showing women in supported squatting positions during labor. The lying flat position that became standard in many hospitals centuries later was, in a real sense, a step backward from practices ancient birth attendants had already refined, adopted more for the convenience of doctors observing the birth than for any benefit to the mother. Pain management, too, drew on an accumulated plant knowledge that modern pharmacology has partially validated. Traditional birth attendants across many cultures used specific herbs believed to ease pain, speed labor, or calm anxiety, and a meaningful number of these plants have since been found to contain compounds with genuine relevant pharmacological effects, including mild pain relief and uterine-stimulating properties. This wasn't universal or reliable in the way modern anesthesia is, but it represented real, functioning knowledge, accumulated the same slow way as every other piece of ancient medicine: trial, memory, and careful attention passed from one generation of women to the next. Where ancient birth attendants proved genuinely skilled was in physical intervention during difficult deliveries. Techniques for manually repositioning a baby that was positioned incorrectly inside the womb, turning a breech baby, for example, appear in medical texts from ancient Egypt, Greece, and China, describing manual techniques that bear a real resemblance to procedures still taught in modern obstetrics today. This required detailed tactile knowledge of how a baby could be repositioned by hand, refined over countless attempts, most of which were never written down at all, existing only in the muscle memory and verbal teaching passed between experienced attendants. For genuinely obstructed labors, where a baby simply could not pass through the birth canal, ancient medicine had far fewer good options, and this is where the era's death toll concentrated most heavily. Some ancient medical traditions describe last resort surgical interventions performed only when the mother was already dying or had died, attempting to save the infant. A grim but telling sign of how seriously ancient physicians took the specific mechanical nature of the problem, even without any way to solve it safely for the mother in that situation. The maternal death rate across most of human history, based on estimates from historical and pre-industrial societies, likely hovered somewhere in the range of 1 to 2% of births resulting in the mother's death. A number that sounds small until you realize most women gave birth multiple times across their lives, compounding that risk again and again with every pregnancy. Combined with high infant mortality from causes entirely separate from the birth itself, it meant that for most of human history, childbirth was reasonably understood by everyone involved as one of the most dangerous single events a person could survive. This didn't meaningfully change until the late 19th and early 20th centuries, when the germ theory of disease led to basic hygiene practices in birth attendants. Attendants washing their hands between patients cut deaths from childbed fever dramatically, a discovery initially mocked and rejected by the medical establishment before eventually becoming standard practice. Modern obstetric surgery, blood transfusion, and antibiotics, developed over the following decades, did the rest, transforming childbirth from one of the deadliest ordinary events in human life into, in the developed world today, one of the safest. Trace the whole arc back, and the story of surviving childbirth is really a story about women teaching women across thousands of generations, using nothing but attention, memory, and the courage to try physical interventions that had never been formally studied but had been watched work, or fail, enough times to be trusted. No single person solved this problem. Every skilled birth attendant who ever lived inherited a body of knowledge assembled by thousands of women before her, most of whose names were never recorded anywhere at all. You are reading this sentence because, somewhere in your ancestry, an unbroken chain of women survived the most dangerous ordinary event a human body can go through, one birth at a time, long before anyone understood why any of it worked.